Good afternoon, everyone. Thank you for joining us again today. I'll start, as I always do, with giving you the daily statistics for COVID. The total number of positive cases reported yesterday was 486. I should point out that is the highest number of positive cases we've ever recorded in a single day. However, for context, it must be remembered that many more people are being tested now than was the case in the spring. Nevertheless, today's number represents 7.8% of people newly tested and takes the total number of cases now to 25,495. Now, that's obviously a real cause for concern, but it also underlines why we took very decisive and very tough action yesterday to try to get the virus back under control. And I will say more about the decisions that we announced yesterday later. The full regional breakdown will, as always, be published later on this afternoon, but I can confirm now that 224 of the cases were in Greater Glasgow and Clyde, 107 in Lanarkshire and 57 in Lothian. Now, it's worth noting that the number for Greater Glasgow and Clyde today is impacted by a significant outbreak at the University of Glasgow. I'll say a bit more about universities and students shortly. The remaining 98 cases are across the other 8 mainland health boards. I can confirm also that 83 people are in hospital with confirmed COVID. That's an increase of 10 on the number I reported yesterday, and 10 people are in intensive care, which is the same number as yesterday. Finally, I regret to report that in the past 24 hours, 2 further deaths have been registered of patients who first tested positive over the past 28 days, and that means the total number of deaths under this daily measurement is 2,508. National Records of Scotland, though, has also just published its weekly update, and to remind you, it includes deaths of people who have first tested positive for COVID in the previous 28 days. That's the same as our daily figures, but it also includes cases where COVID is a suspected or a contributory cause of death. The latest NRS update covers the period to Sunday, 20th September, so it won't include the death I reported yesterday or the 2 that I have reported today. Up to Sunday, we had recorded 2,505 deaths in our daily figures, and 6 of those had been registered in the preceding 7 days. Today's update shows that by Sunday, the total number of registered deaths with either a confirmed or a presumed link to COVID was 4,247. 11 of those were registered in the previous week, which is 6 more than in the week before. 8 of those 11 deaths took place in hospital. 3 of them occurred in care homes. Now, every single death from COVID, including, of course, the 2 that I've had the sad duty to report today, represents the loss of somebody who was loved by their families and by their friends. So again today, I want to send my condolences to everyone who is in that situation of having lost a loved one to this virus. Now, yesterday, I set out in Parliament new restrictions to stem the recent rise in cases and to try to get the virus back under control. I will quickly recap on those restrictions in a moment. First, though, I want to just say something about universities and students. Just as it's important, and I think we all agree this is important, for children to be back at school and back in education, it's also important for our students to be back as far as is possible at college or university. And this is in no way, shape or form the fault of students, and I want to be very clear about that. But we do know that student life, the characteristics of student life, present risks of transmitting the virus. So we need to do everything we can to mitigate against those risks while allowing, as far as is possible, students to have the experience of college and university that they value so highly. We have tough guidance in place, and we are discussing with the sector today if there are further steps we need to take. The National Incident Management Team is considering this as well. And I want to be clear, if we need to strengthen our guidance, we will. We strengthened the guidance for schools after schools had been back for a few days in light of the experience, and we will not hesitate to do that with the further and higher education guidance too. But today I want to appeal directly to students for your help in this. I know that the vast majority of you will already be doing the right things, and I want to recognise how tough that is, and I want to thank you for it. But it's also important to underline a key point for students living in halls or in shared accommodation and who might be watching today's briefing. If you are asked to self-isolate, and I know many of you right now are already in that position, it is really, really important that you follow that advice. As we've seen in the past few days, COVID can spread very quickly in shared living settings and halls of residence. So please follow the rules on self-isolation, take all the advice that is given and make sure you do it in the way that is asked. Also, please observe all of the facts rules at all times when you're going about your daily lives. And please abide by the new restrictions on household gatherings that we announced yesterday. They apply to students just as they apply to the general population, even though, of course, your living arrangements are often different. Now, Jason's going to say a bit more in a moment about what we are asking of students. But please, from me for now, please know that we appreciate the sacrifices you are making at this really important stage of your lives. It's not yesterday that I was at university, but I still remember what an important stage of life it is, and nobody wants you to be living under these restrictions. But it is important that you do take care not to put yourselves at risk, and obviously not to inadvertently put other people at risk. And what we're asking you to do now is for the collective good of everyone. But we do appreciate your sacrifices, and I want to thank you for it. Now, as I said yesterday, the new restrictions taking effect this week are tough, but they are not a full-scale lockdown. It's important to remember that. They are, in fact, designed to try to avoid a lockdown of the type we had earlier in the year. We hope that by all of us abiding by these restrictions and helping to get COVID under control again, we will be able to keep schools open, we'll be able to get non-COVID NHS services up and running again, protect care homes and safeguard jobs and livelihoods. These are the things that matter to all of us, and obviously they matter to society overall. But in the face of a pandemic, of a virus that as yet has no vaccine, and with that virus on the rise again and winter ahead of us, if we are to achieve these priorities, we have to make sacrifices elsewhere. No country right now is able to have 100% normality. So the measures we announced yesterday are tough, but they are absolutely essential. And they are targeted to deal with some very specific factors which we know are helping to drive transmission. The first relates to household gatherings. We know from our test and protect system that a significant proportion of new cases come from social interactions between different households in our homes. And it is clear that once this virus gets into a household through one person, it is likely to infect everybody in that household, and therefore if there is another household visiting, it is likely then to pass from one to the other, and that's how, or one of the key ways in which we know the virus is spreading. So we need to deny the virus the opportunity to spread in that way. And that is why from today we are all being asked not to visit each other's homes. That recommendation will be put into law later this week, but it is important that we all comply with it now. There are, of course, some limited exceptions, as I mentioned yesterday. Childcare, extended households and tradespeople, for example. And it's probably worth reminding people, because it's a wee while since we had to talk about this, extended households are where people who live alone or live alone with children can join with another household, but it has to be the same household all of the time. And it's also important to remember that if any member of an extended household gets COVID, the whole household then needs to isolate. You can also still meet up with another household outdoors, including in a private garden, as long as there's no more than 6 people in the group. And as I mentioned yesterday, there are no limits for children under 12 playing outdoors with their friends, and young people aged 12 to 17 will be able to meet outdoors in groups of up to 6, physically distanced, but they don't all need to be from just 2 households. That's a tough restriction, not allowing people to visit others' homes, but it is one of the key ways that we believe we can get control of the spread of this virus. So tough though I know it is for all of us, including me, I'm asking everybody please to abide by it. The second new restriction relates to hospitality. From Friday, all hospitality premises, pubs, bars, restaurants, will be required to close at 10 p.m. each evening. And the aim here simply is to reduce the amount of time people are able to spend in licensed premises, thereby again curtailing the spread of the virus in an environment where we know there are higher risks, while still allowing businesses as far as possible to trade and to provide jobs. However, as I said yesterday, we also need to and intend to ensure that all businesses comply with all of the hygiene, safety and mitigation rules. The vast majority do that already, but it is important that all do, and local authorities have powers where necessary to inspect, enforce and indeed close premises if they are not complying. So that is something we monitor carefully and take very seriously. The last restriction we announced yesterday sounds minor, but is important, and it relates to travelling by car. Again, we know from test and predict data that sharing car journeys presents a risk of transmission. So we're advising against car sharing with people outside your own household if possible, unless there's no alternative. Of course, that doesn't include taxis, and there, of course, we advise people to wear face masks. So those are the restrictions we announced yesterday. As I keep saying, because I know it's true, they are not easy for people to comply with. But they have not been imposed lightly, and I believe that if we all abide by them, they will make a difference in trying to get this virus back under control. But I wanted to return just briefly to the issue of hospitality, because many of you might be amongst these people, but many people ask me why we don't just close pubs completely right now. And actually, that is not an unreasonable question. And as I said yesterday, if the Scottish Government had the power to borrow money or to extend the furlough job retention scheme so that we could mitigate the impact on jobs, it is very possible, perhaps even likely, that we would have reached a different decision yesterday on hospitality. But we went as far as we could within the powers that we have. And that takes me to a general point, and I've thought very carefully about whether to make this point today because it is genuinely not intended to be political or constitutional. And, I know some people won't believe that, but it is absolutely the case. But it reflects a genuine worry I have as First Minister right now, and that is that we mustn't be hamstrung in essential public health decisions by the lack of necessary economic mitigations. All 4 UK nations yesterday agreed a joint statement to the effect that we would focus our efforts, and I'm quoting from it here, on suppressing the virus to the lowest possible level and keeping it there. And that is really positive, because it puts aside, hopefully forever, this idea that we can just let this virus run. We must keep it suppressed because we know it does real damage in lives and in health. But if that's the objective we've signed up to, we all have a duty to ensure that our actions live up to it. We took tough action for Scotland yesterday, tougher than some other parts of the UK, and I believe that the situation we face absolutely merited that. But there is an argument, and I've heard some experts articulate it even this morning, that all of us across the UK should actually be doing even more right now. And there is a danger that what starts to hold us back is not the public health analysis, but financial limitations. So I'll be writing to the Prime Minister today, and I hope constructively, because I recognise that the economic implications of all of this for the Treasury are not easy. But I'll be right in asking that we do have urgent discussions to make sure we can get to a position where the fear I've described is not the reality. And that either through UK government action, the extension of furlough, for example, or some reasonable but necessary fiscal flexibilities for the devolved governments, through these ways, we are all able to reach the decisions we think necessary to suppress the virus and save lives, while also mitigating the impact on jobs. We are right now, I think, at the most critical juncture since March. And as I'll come on to say in conclusion later, in many ways we are in a stronger position because we know more about this virus, but we must make sure we use that knowledge quickly, decisively and urgently. And I want all of us to be in the best position, equipped in the best possible way to be able to do that. Now, to close today, it's probably worth just reflecting on the fact that this is, to the day, 6 months since we went into lockdown on the 23rd of March. None of us would have wanted to mark this milestone against the backdrop of new restrictions. And I know, and this weighed heavily in my mind all day yesterday and last night, I know so many yesterday, me included, probably were feeling a bit downhearted that after all the hard work, we seem to be back to square one. But I want to stress to you today that that is not the case. That is emphatically not the case, even although I understand why it might feel like that. The situation now is not the same in certain respects than the one we faced in March. For a start, the action we took to suppress the virus over the summer meant that we have faced this resurgence from a lower base, and that matters, and that is entirely thanks to the lockdown restrictions and all of the individual sacrifices everyone has made. The rise in new cases, while it is accelerating, is also not as rapid as it was earlier in the year, but we must guard against it becoming so. And of course, we now have Test and Protect up and running. It is working well. It's tracing contact and breaking transmission chains. And as I said a moment ago, we've learned a lot more about this virus. We still don't know everything about it, but we know much more about it now than we did in March. And crucially, we know, because we've done it, that through our collective efforts, we are capable of getting it under control. And that's what we need to come together again to do now. These new restrictions will help us do that, but they will only help us do that if each and every one of us as individual citizens play our part and abide by them. So please comply with all of these restrictions, because they will make a difference if we all do. If you haven't already, go to protect.scot, download the Protect Scotland app. That will help expand the range of people that can be quickly contacted and asked to self-isolate if they may have been exposed to the virus. And remember at all times, when you are out and interacting with other people, the facts rules: face coverings, avoid crowded areas, clean hands and surfaces, 2 metre distancing, and self-isolate and book a test if you have symptoms of the virus. And finally, remember that although these times are hard, as I tried to remind everybody yesterday, they will pass. And they will pass a bit more easily and possibly a bit more quickly too, if we all continue to look out for each other. So let's pull together in the same way that served us so well 6 months ago in March. Let's stick with it. Let's stick together. And if we keep doing that, I'm not going to tell you it will be easy over these next weeks and possibly months, but I am going to tell you with a great degree of confidence, if we stick with it and stick together, we will get through this. My thanks again for everything you're doing. I'm going to hand over now to Jason to say a bit more about students before, as usual, we'll take questions from the media.
Thank you, First Minister. So I also want to directly address students in Scotland today. I understand they may not all be watching a lunchtime press briefing, but if you have a student in your family, maybe you could pass these messages along. They've all started back and things seem very different from what you may have hoped. So I'd like to start by thanking each and every student in the country for everything you've done so far to help us with the spread of coronavirus. I spoke yesterday in a particularly busy day to all of the student leaders in Scotland, hosted by the National Union of Students. We discussed what more they could do and what more messaging they could help us with. There are now, though, a number of outbreaks in our higher and further education institutions around the country, with significant numbers now of positive cases. We need every student across Scotland to do their bit to help us stop the spread of the virus. And I'm going to suggest they can do that in 4 main ways. Firstly, if you have any symptoms of the virus, and you know those 3 now, you need to book a test immediately and self-isolate immediately. And we'll come back to self-isolation in a moment. Secondly, we need you to download the Protect Scotland app onto your mobile phone. This app, as you know, will alert you if you've been in close contact with a positive case. And if you test positive, it will help in determining the contacts you've been close to. Using the Protect Scotland app at the same time as sticking to the public health measures contained within facts will help us all to stay safe. Thirdly, follow the Test and Protect advice and the advice from your institution. The Test and Protect system has already asked a number of you to self-isolate due to outbreaks either in your halls of residence or in your other shared living accommodation. If you've been asked to self-isolate, it is vital you do so for a full 14 days. We understand, both for you and for the rest of the country, how difficult that demand is. This means that you need to remain in your accommodation and not to go out for any reason, not even to buy food or other essentials. The college or university can help support you with advice and guidance and supplies while you are self-isolating. During this period, we need you to avoid close contact with others you may be living with. You can do this by staying 2 metres away from any other people, not sharing towels or clothes, sleeping alone, asking friends who are not self-isolating to get your shopping or arrange for a delivery to be left at your door, washing your hands with soap and water for 20 seconds, cleaning any shared toilets, bathrooms and kitchens every time you use them, keeping the number of people in shared areas to an absolute minimum, and really importantly, making sure you keep in touch with friends and family by phone or through social media. Self-isolating is really, really hard, but it is vital to prevent the spread of this disease. And fourth, we need you not to have house parties. I could not be any clearer. By all means, socialise in licensed hospitality venues where a maximum of 6 people from 2 households can meet, but no meeting up in other people's homes or in your shared student accommodation. The new rules coming into force today state that you may not meet people from other households in your home or in other persons' homes socially, unless they are in your extended household. And a maximum of 6 people from 2 households can meet in outdoor spaces. This applies to you, just as it applies to the rest of us. Parties are not allowed. I'm sorry, and I hope they come back soon. So in summary, 1, if you get symptoms, self-isolate immediately and book a test. 2, download the Protect Scotland app. 3, if you're asked to self-isolate, actually self-isolate. And 4th, no parties. First Minister.
Thanks, Jason. We'll move to questions now. Lisa Summers from the BBC.
Yeah, First Minister, obviously we're all being asked to make more sacrifices as we head into winter, which is going to be difficult. So can you help with some kind of clarity on the data that you're using? In the summer you were talking about an elimination strategy for the virus. Now you're saying the kind of 4 nations approach is to suppress it as much as possible. What's kind of changed there? On things like you say that a significant proportion of cases are coming from households or hospitality venues. And you also say that you're seeing evidence that the restrictions already in place in the west of Scotland are having some impact. So can you tell us what proportion of cases are coming from households, what are coming from hospitality, and what is the rate of reduction that you're seeing in the west of Scotland that makes you think that it will work for the rest of the UK? And if you can't share that data, why can you not share that data?
I'm trying to be as open. Use the term suppressing to the lowest level in the 4 Nations Agreement because not all governments wanted to use the term elimination. But when I say suppress to the lowest possible level, I mean eliminate. As you've heard me say before, elimination is not eradication, right? Eradicating a virus like this won't happen without a virus. Elimination means you try to keep it at the lowest level you can. Now, during the summer months, when everybody's under lockdown, that is easier than it is in winter when we've got fewer lockdown restrictions because the virus has more opportunities to spread. So the level that the lowest level possible will be at any given time will change. But it is about, whatever our circumstances, our objective is to keep it as low as we can. And that is in contrast to the view that I think is a minority view, but you do hear it expressed more now, is that maybe COVID is not as serious as we thought it was, so we should just let, particularly amongst the younger population, we should just let it circulate and build up herd immunity. I think that is the wrong approach because COVID does kill people. It has bad health implications even amongst younger people. And we know that for vulnerable people in particular, we can't hide them away forever. We've got to collectively keep it under control. So I hope that is clear about what we mean by suppression and elimination, which in my view is different words to describe the same thing. But in the interest of consensus across the 4 nations, I was happy to sign up to that particular articulation of what it is I mean. In terms of, so we are looking, Jason and I had a conversation about this morning, about how we share more data about the sources of infection and transmission. The complication in that, and I'm as keen as anybody to do it because it's in my interest for people to understand the risks as fully as they can. But when Test and Protect speak to people, people will tell them where they've been. So people might say, I saw my family at the weekend, I was also in a pub, I was at work, I was here as well. So what Test and Protect cannot always do, certainly initially, is know exactly which of these environments is where they got the virus. So it could be one or other. So you can't always be clear that because somebody has been in X setting, that is absolutely where they got the virus. So we've got to think about how we put this information out there in a way that is understandable and has a degree of accuracy about it, albeit it will still have uncertainties. And that's what we're trying to work through just now. What we know for sure, though, is that if you look at the themes that are emerging from all of that, and remember people will be quoting different interactions that they will have had. We don't live our lives by only doing one thing every day, but what emerges from this is that the themes, the two top themes, when you look at everything that people are saying, are household interactions within homes, amongst family and friends, and hospitality. And that is beyond any doubt. And, you know, in some ways, you don't even need data to tell you that. Common sense tells you these are the kind of environments where people are more likely to be exposed to transmission. And I think particularly in homes where, you know, if in pubs right now, you, at least in theory and in most of them in practice, there's strict guidance about distance, hand washing, face coverings. None of us do that in the same way in our own homes because it's really hard to do. So again, common sense tells you that. But we are trying to think about how we present greater quantification of that information, but in a way that doesn't inadvertently mislead people. So I hope you understand that's the kind of process we're trying to go through. And similarly on Glasgow, the IMT looks at this closely, and we may be able to get more figures that actually, again, start to put a bit more detail on this. What the data starts to tell us in Glasgow is not that these restrictions yet, and remember the life cycle of this virus, the restrictions we announced yesterday that come into effect this week, they will take a bit of time to start to show any effect, because many people who will show up in our cases in the next days and weeks will already have been infected. But what the data tells us is not that these restrictions have yet started to reduce cases in Glasgow, but they have slowed the rate of increase, particularly around household settings. Now, what we are also seeing in Glasgow, which goes in the other direction, is the kind of university outbreaks that we are talking about today and dealing with. So this is complex, and I don't do anybody any favours if I try to oversimplify this data, but we do try to present it and explain it in as accessible a way as possible, and where we can, put figures that help with that. And that is an ongoing process just now that we are seeking to do more of. Jason, do you want to pick up on all the bits I've undoubtedly got wrong in that explanation?
It's not wrong. It's really difficult. Sometimes test and protect is straightforward. If you were one of the workers in the Cooper Angus chicken processing plant and you were positive, it's very, very likely that's where you got it. That wasn't in hospitality, it probably wasn't in your home, but it may have spread inside your home. Often it's not as simple as that. It is 48 hours of detective work to say, were you at your mum's? Were you in hospitality? Did you car share? Did you take the kids? And you never know for sure until you do genomic studies weeks and months later exactly where that individual strain of the virus came from. But we know, if you think it in reverse, if we wanted the virus to spread, what would we do? We'd put households together. That's the simple truth. So if you can stop households coming together, that's going to suppress the virus. It just makes common sense. And the two places where people come together most often is in their own home and in hospitality. So you have to do something. If you want to suppress the virus, you have to do something in both of those areas. And that's what you've seen us do. I can't give you, I was asked yesterday a lot, give us the exact percentage of people who caught it in a pub. That is impossible. And if people tell you they know that number, they don't. I know that a significant proportion of people who are positive have had hospitality interactions and household domestic interactions.
Yeah. And just to complete this point, because I took ages to answer that question, for good reason, but a couple of weeks ago, the figures were telling us that a significant proportion of people testing positive were reporting that they had recently returned from overseas, in particular Greece. Now, that led us to take action to put Greece on the quarantine list. Now, that is not allowing us to say definitively that all of these people got the virus in Greece and brought it back. But it was a theme emerging that a high proportion of people were saying, I've tested positive and have been in Greece. So you have to put, it is detective work, you have to put different clues together and reach judgments on what is happening. The good news is the proportion of cases that are reporting overseas travel has actually started to fall, which, you know, is a sign that we're out of the summer holiday period, but that's a positive sign. So this is, in some respects, it would be easier for all of us if it was like a jigsaw and you just fitted pieces together and they absolutely fitted and you know where they all went. This is more like detective work of trying to pick up on all the clues and all the indicators and build a picture that allows you, with as much intelligence and judgment as possible, to attack the virus in the way that will be most effective. Shihab Khan from ITV News.
First Minister, you are looking at the same data that is being used by leaders across the United Kingdom and drawing different conclusions about what needs to be done. Why do you think that's the case? And are you expecting others, including Boris Johnson, to follow your lead and have harsher restrictions? And a second question, if I may, you mentioned as you were talking there that you want more devolved powers, especially when it comes to the economy, to deal with this crisis. Is that because you feel as though Westminster aren't making the right decisions and you are hamstrung in what you can and can't do?
Again, I'm going to try to be as non-political as I can be here, because these are not political, they're not traditional political arguments. The first bit of what you described there, we're all looking at the data and reaching our own decisions. That, in a sense, is the nature of political decision-making and accountability. We all have to answer for our own decisions. I look at the data just now, and I think a curfew on pubs is a positive thing to do to try to reduce transmission in pubs. If I had the ability to bring more financial firepower to mitigate the jobs and economic impact, I probably would have gone further on pubs, is what I'm saying. But I don't think just taking action in pubs, whether it's a curfew or more, is enough, which is why, and that's because of everything we've been saying about household interaction, which is why I've taken the tough decision on household visits and not being in each other's homes. I think we're at a critical moment right now, and I think all of us have to ask, are we doing enough, and are we doing it quickly enough? And one of the things, and that's why I'm trying constructively and as non-politically as possible to put this on the agenda, is because I, as First Minister, I want to be able to take these decisions based on the best advice, applying my judgment, and then being accountable for them. I don't want to feel between a rock and a hard place of saying, well, over here, the public health analysis is saying we should do more, but I don't have the ability to mitigate the jobs impact. So either we need to come together across the UK to say, let's do more with the right financial interventions, and top of that list would be extending furlough, or we have greater flexibilities for the devolved administrations where we can take these decisions without that sort of constraint that we are perhaps all under right now. And we all want to achieve the same things. I'm not going to criticise. I've stuck to this all along. I'm not going to criticise any other leader across the UK. We're all making the most horrendously difficult decisions right now. And I believe that all of us are trying to do the right thing for the best reasons. And because we come to different conclusions, it shouldn't take away from that. But we should all be able to take these decisions without unnecessary constraints on us. And that's what I'm arguing just now, and I hope we can have constructive discussions. We've had constructive discussions this week about the situation we're in just now, and I hope we can continue that, because none of us want to be in a position a month or 2 months from now where we wish we'd done more. And I don't want to be in a position of the only reason I didn't do more was because of powers outside my control. If I get the judgment wrong, that's on me. That's for me to explain. But I don't want to be thinking, I think I should be doing more here, but I can't because of financial constraints, and not being upfront about that. And I think that's a really important part of transparency. Ross Govins from STV News.
Afternoon, First Minister. How do you address the concerns of some in the hospitality trade that by implementing a 10 p.m. curfew, you're almost tempting, especially the young, into gathering illegally later on? Are you expecting them to stop socialising at 10 o'clock at the weekends? And that results in people gathering in illegal house parties, or, as you're so concerned about, halls of residences.
Look, I'm going to say something here that is the really difficult message. Yes, I am asking people not to socialise normally, and I don't want to be doing that, but it's essential to stop the spread of this virus. So that is why, I think if you have a 10 o'clock curfew, which I think is the right thing to do, whether it is enough in hospitality is the issue I've been, sort of opining on a little bit today, but it is right to do that. I certainly don't think we should have done less than that in hospitality. But not the only reason, but the other reason why you also have to deal with the risk in households is to make sure you don't just transfer a risk from one place to the other, that you're trying to tackle it across the board here. So I'm saying to people, and I know how difficult this is, you shouldn't be taking the curfew as an invitation to go and do what you would have been doing in pubs after 10 o'clock somewhere else. That does defeat the purpose. And I can make the rules with all of my advice and discussions with ministers and stand here every day explaining why we've reached decisions. But ultimately, these things are only going to work if we all abide by them. I keep saying something, and I don't just say it for kind of trite, cliched reasons. We all depend on each other right now, because if I say this is what we think we should do to curb the spread of the virus and nobody does it, it's not going to work. And with the best will in the world, I can't, I can't change that reality. So I need people to work with us. And that's why I know I can be verbose about it sometimes, but it's why I stand here day after day trying to build an Jason laughed when I said I was verbose. He often makes that point to me. He can be the same as well. But seriously, I stand here trying to share the thinking and explain it to the best of my ability so that people out there watching, you don't just feel that I'm standing here saying, do this. I'm trying to explain why it's so important to do it. And I'll keep doing that, I'm sorry to say, for as long as it takes, because this is so important. It really is. This is the most important thing I've ever had to do. It's the toughest thing I've ever had to do. But lives depend on it. So if for as long as it takes, I will try patiently to explain to people why don't go from the pub at 10 o'clock to a house, because you'll be defeating the purpose and you'll be putting lives at risk. And I hope that message gets across. Jason, do you want to be less verbose?
Usually not. So none of this is normal. You suggested in the question that somehow we'd be asking people to move from one abnormal setting, and let's just go back into a normal. Table service in a pub isn't normal. Distancing between two couples who go out for dinner, it's not normal. We're not going to be normal until science gets us out the other end of this. So until then, yes, I've just asked all the students in the country, the week they start higher education, not to have a party. That doesn't feel very normal to me, but it is to protect them and the whole population.
Admirable brevity. Tim Batchel from ITV Border.
Thank you very much. Good afternoon. With the very high numbers that you told us about today, does that suggest that these new restrictions you're bringing in might not be enough, in fact? And on the other side of the coin, can you explain why you decided that nationwide restrictions were necessary, where in some areas there have been very few cases, areas like Dumfries and Galloway, for example?
Well, one of the lessons I've tried to learn over the last 6 months is that, and with the help of people like Jason, who've given me lessons in virology and epidemiology, and I'm a lay person on these things, but I try to learn and listen to advice, is that when you're dealing with an infectious virus, the mistake you can make is waiting until you have a large number of cases, because by the time you have a large number of cases, it is too late to take the action. And yes, you can take action, but you will still then have a lot of deaths that are, pardon the inelegant expression, baked into the situation because you've waited. So what we're trying to do is get ahead of that and put in place restrictions that hopefully mean that Dumfries and Galloway never get a big number of cases again, because we've acted preventatively. And that can be hard. I know there'll be people in Dumfries and Galloway, there'll be people in huge tracts of the Highlands just now, in the islands in particular, saying we've had hardly any cases. Why are we having to live this way? But it's to try to stop you getting cases, because when you get, and all parts of Scotland, including our islands, have had cases in the past couple of weeks. And often with this virus in particular, it can be a very short period of time between one case becoming 10 cases, becoming 100 cases, becoming more than that. So it is basically just good old-fashioned preventative action. And I know that's tough, but we are trying to learn as we go through this virus and make sure we're applying the knowledge we've got to the best of our abilities.
We have a virus that's in the wild has an R number of about 4 and an incubation period of 5 to 14 days. So you have to adjust your advice accordingly. If we were dealing with measles with no vaccinations, it's got an R number of 18 and an incubation period that's short. So your interventions would be faster, harder, and you'd be able to move in and out longer. We can't adjust the nature of the virus. So the virus is the virus, to not state the obvious. So an R number of 4 if you let it go, and an incubation of 5 to 14 days. And you have to therefore put interventions in that last a while, because you're not going to know. In Spain, we've seen 4 generations of incubation period before it got to the elderly and led to admissions and deaths. So you've got to give what you do time to act. And that also means you've got to act quick, decisively, before the numbers get out of control, which is the First Minister's point.
And you asked me, Tim, did I think the numbers might mean we would have to do more? And this is a point I'm trying to make today. I do think there is an argument that even in Scotland, with our tougher restrictions than some other parts of the UK, certainly England with the household restriction ban, to use that word, that yes, we will have to do more. I heard a member of SAGE on the radio this morning saying that very thing. The rock and a hard place argument I'm making here in Scotland is that for Scotland now to do more takes us into areas that have real economic and jobs impacts. And that is not me saying that means we shouldn't do it. But if we are going to do that, we need to have that discussion across the UK about how we, to the best of our ability, mitigate that economic impact. And that is, you know, I have tried very hard throughout this not to get into political and constitutional territory, and I'm still trying that. That is not me trying to do that. But I also have a duty when I'm coming up against just hard facts here that I make that clear. If we need to do more, we need to also have the tools in order to do that. And that's the discussions I hope we can progress. Alan Smith from Bauer.
Thanks, First Minister. Just looking for a point of clarification on what the changes to the restrictions on household visits means for people in self-isolation. For example, in the west of Scotland, where these tight restrictions have been in place, anyone contacted by a tracer, the entire household has to self-isolate. Will that now mean, with these restrictions being extended across Scotland, that's the same rule for self-isolation? And just secondly, if I may, in regards to comments advising people against booking overseas travel during the October break, Radio 4 has had a number of families get in touch who've already booked holidays for the October break, and they're just looking for a bit of advice on what they should do. For example, should they cancel those holidays?
Look, I'll hand over to Jason on household isolation. We are considering nationwide whether the advice on household isolation goes beyond just the close contact and involves their whole household. That you're right, in the sort of restricted areas, if I can call them that we've had in the last few weeks, we've said that, and I think we will possibly move to that nationwide, but that is under discussion at the moment. On travel, this is probably where I have to be frank with people. I'm the First Minister, but I cannot make every individual decision for families across the country. What I feel a duty to do is give you the benefit of the best advice that I can. And I've been saying now for weeks, if not longer than that, that people should not be going overseas unless it's essential. And I've tried to give that advice to try to so if people are booking, they're at least doing that in full knowledge that things could change while they're away and that there are risks associated with doing that. But I can't make individual decisions for families. But I can say that I wouldn't be booking a holiday overseas right now for a number of reasons. And I know this is really hard for the tourist sector, for tour companies, for airlines and airports, and I recognise that. I don't say this lightly. But we know that this is an accelerating global pandemic. There are risks that you get the virus when you're overseas, you bring it back, that presents risks to all of us, but there's also risks that you get to your destination and the rules change while you're there and you find yourself isolating in your hotel for 2 weeks or facing quarantine when you come home. I come back to this, we're dealing with this in Scotland right now, and it's tough, and we're talking about all the implications for us, but I come back to the two words that should always be in our minds: global pandemic. This is spreading right across the world right now, and I would argue that in a global pandemic, it's maybe sensible to stay as close to home as possible rather than travel overseas, and that's the best and frankest advice I can give people. Household isolation.
So the actual rules, Alan, are as you've described them. So in the 7 extra restricted local authorities in the west of Scotland, if you are a contact, not a positive case, if you're a contact of a positive case, your whole household has to self-isolate for 14 days. If you're in the other 25 local authorities in the country, you do not have to isolate your whole household, only the contact does so. It's quite an extreme public health measure to ask the whole household of a contact to restrict their movements for 14 days. We will consider that if and when we think it's required. It is, of course, linked to the announcement across the whole of the UK yesterday you heard the First Minister make about the £500 means-tested isolation benefit payment for people. So we have to see what that is going to include and then make some decisions, or the First Minister has to make those decisions about how we extend that. But our advice, presently is in the 25 with lower prevalence. Remember, that's why the 7 are extra restrictions. In the 25 without that big number, then we're suggesting just contacts only.
Thanks. Right, I will try and speed up a little bit, going through we've still got a long list of questions. Becky Clark from Global.
Thank you, First Minister. On the issue of universities, you're saying you're dealing with a significant cluster at Glasgow University. At the weekend, St Andrews asked students to take part in a voluntary lockdown. And when we're seeing hundreds of students in self-isolation in Dundee as well, do you back education bosses if they do decide to enforce that sort of hyper-local lockdown in halls of residence to protect the wider public?
Yes, I support fully universities in colleges in taking action they think is necessary, albeit proportionate, to deal with any outbreaks or risks of outbreaks on their campuses. And I would go further than that. We have asked universities to do that. We've put in place guidance. We talk to the sector regularly. There's discussions with the sector ongoing today to see whether we need to strengthen the guidance in any particular respects. But yes, this is a partnership approach. But universities, if they're doing sensible, precautionary, proportionate things, then they have my full support in doing that. Neil Pooran from PA.
Thanks, First Minister. On contact tracers, the Scottish Government previously said that it hoped to have 2,000 contact tracers in place by the beginning of June. Now, we now know that that target was missed and there's less than 1,000 available just now. Why was this the case, and is there any plans to set a new target given the rising number of cases?
So it's not the case. Firstly, and I remember setting out way back how we were going about the recruitment of the pool of contact tracers, so I appreciate people won't remember that, but I'll just set it out again. So what we asked health boards to do was identify a pool of 2,000 individuals that could be called upon if they were needed to be contact tracers, and that's what health boards did, and that target was met, and health boards are able to call on these people. These are people that often have other roles within health boards but are available when the demand is there to be contact tracers, and health boards have been making sure that they have the right resources in place to ensure that they can deal with the contact tracing demands that they have. We've asked health boards to make sure, so the resources health boards have right now can deal with the number of index cases that we're dealing with. They also have the ability and plans in place to, over a 24-hour period, if they needed to, double that if index cases suddenly took a significant rise. So they have that pool. What we then were doing was replacing that pool of people that they had identified with newly recruited permanent contact tracers. And that process is underway, and that will be completed, I think, over the next number of weeks. So what I think is really important to be clear about is health boards have the contact tracing resources that they need. I'm not saying they are never under pressure, because of the nature of this, they will often be under pressure. And health boards have also, when there have been outbreaks in one area, helping each other with mutual aid, which is what we would expect to happen as well, ordinarily. And the final point I would make, Jason might want to say a bit more about this, is and again, we're not complacent about this, but the performance of our Test and Protect contact tracing is very good. Since we started the Test and Protect contact tracing, over 90% of index cases and contacts have been successfully contacted and told to self-isolate. Now, by any standards, that is a high proportion. So this is a well-functioning system, but one that we know we have to continue to build the resilience of as we go further into the winter.
I think you've covered it. The only other thing I would add is that we have another buffer, and that is the difference between local health protection teams and the National Contact Tracing Centre. So if you're in Glasgow just now and you have an outbreak amongst students and your contact tracers want to really power through them in a 24-hour period, because the quicker the better, they can pass some of those cases up the chain to the national centre. They can do some, feed them back. And that allows us to move that resource around the country where the outbreaks are. So I'm very confident that contact tracing system is working well, and it can double within 24 hours.
Conor Matchett from the Scotsman.
Thank you, First Minister. Just going back to something you said yesterday that I was looking for a bit of clarity on. You said that you were going to publish a strategic approach to isolation in high infection areas as a replacement to route map. Wondering what that actually means, Going back to something you said earlier as well, you said that some governments didn't want to use the phrase elimination in the letter published the other day. I'm wondering which governments didn't want to use that phrasing, if at all possible, if you can add to that.
I wasn't intending to make that sound as if it was one government standing in the way. We tried to come to a form of words that best express what we were all trying to say, and rather than get caught up in terminology, we accepted that was the best description. And I'm saying that what I mean by suppressing to the lowest possible level is the elimination that I was speaking about. There's not a distinction in my mind between those two things. And the first part of your question, effectively what we will publish is, you'll have heard me saying over the last few weeks why, in some local outbreaks we've applied some measures that are different to the measures we've applied in other local outbreaks. So what we're trying to do is bring that together in a more coherent sort of strategic approach that gives people a sense of, what the different tiers of escalation might be if you're dealing with different levels of the problem in different health board or local authority areas, and also what the tiers of some of the escalation might be depending on whether it's a factory outbreak or a pub-based cluster or a more local community transmission. So that's what we're seeking to do. It won't answer every question, but it will give people just a general sense of the kind of decisions that we make. One of the other things I've learned about this virus or tackling this virus is we've actually got very few levers to pull, but we need to know which ones to use in which circumstances. And I would remind people right now we've got rising transmission across the country, and therefore we need to think of it in that nationwide sense as well as looking at particular hotspot areas when they arise. Simon Johnson from The Telegraph.
Good afternoon, everyone. You've just announced the highest daily COVID total on the six-month anniversary of lockdown. What's gone wrong with your elimination strategy? And secondly, the first ban on not visiting other households lasted 16 weeks between March the 23rd and July the 15th. Can you give people any hope that this second ban won't last as long?
I hope the first part of my answer to this doesn't sound facetious. It almost certainly will, and forgive me, even I get tired sometimes. What's gone wrong? I haven't single-handedly managed to find a cure for COVID, possibly is the best answer I can give you. Other than that, we're trying to deal with COVID. Every country's trying to deal with it. I don't know if you were on earlier on when I tried to explain what elimination means and why it is still relevant today. It means in any given circumstances, and summer, with everybody in lockdown, it's easier to eliminate a virus than in winter with people largely out of lockdown. But in whatever circumstances you're dealing with, your approach and your strategy should not be to allow it to run out of control, but to drive it to the lowest levels you can get in those circumstances. And that's what we're trying to do. But it is an infectious virus that is circulating globally, and therefore elimination doesn't mean you get to a point where you've defeated it and that's it, it's gone away. That's the point you would get to if a vaccine comes along that allows you to eradicate it. So elimination is never a fixed point in time. It's an ongoing battle with the same objective, knowing that sometimes that objective will be easier, sometimes it will be harder, but that's what you're trying to do all the time, drive it to the lowest possible level. And that is what elimination means. The second part of your question was how long. Look, I can't answer questions how long because I've tried to be straight with people. There are some questions I just can't answer definitively, and I'm trying not to give people the easy answers that they want to hear when I don't know whether they're correct. I'm trying instead to be frank with people, even if that is tougher things that we'd all rather not hear. What I do believe, though, is that the earlier we act and the more decisively we act, the more chance that we get it under control more quickly, and therefore the shorter a period of time we might be living with these restrictions. Again, one of the things I think we've learned over the past 6 months is you don't hang around with this virus, because when you do that, it takes longer to get it back under control. And that comes back to a central point I'm trying to make today. I think there's an argument, even with the tougher restrictions in Scotland, that we need to do more. But for me to do more, I get into the economic and financial territory that I need to have a discussion or try to have a discussion with the UK government about to make sure that we are not curtailed in what we are able to do in that way. Tom Martin from the Express.
Hi, thank you, First Minister. You've referred to it a couple of times already about the possibility of doing more with extra financial flexibility. What specifically do you have in mind? What would you like to do more?
Again, and I'm using illustrative examples here, so don't take this as, but take hospitality. Many people say to me, you know, instead of having a curfew, why don't you just, for a period, close pubs again? Maybe not restaurants, because there's a different, you know, environment there, but where people just go for a drink, why don't you close that? Now, I can see the public health argument for that, and Jason probably would stand here and give you the public health argument for that. But if I do that, I immediately put a lot of jobs on the line. Now, if I was able to, and you know, when we closed pubs in Aberdeen, pubs were able to go back into the furlough scheme, but time is running out for them to do that. We were able to give some extra, we gave the £1 million support fund for businesses in Aberdeen, but trying to do that within our financial constraints across the whole country, particularly when furlough is being taken away, becomes just impossible to do. So what I want to be able to do is look at problems and say, if the public health advice is saying, you want to get this virus under control, you have to do this, then I can take that decision if I think it's the right one and take corresponding decisions to deal with the consequences of that. Now, obviously, no government's resources are completely infinite, but the UK government has the power to borrow that we don't. So that's what I'm just trying to be frank about here just now. And I think the UK government will probably find itself maybe thinking about doing more in the weeks to come. But if we all think we might be having to do more in a few weeks, why not try and work out how we do it now and not wait a few weeks, and how we deal then with the economic implications of that. Mark McLaughlin from The Times.
Good afternoon, First Minister. Yesterday, you said it would be unethical to follow the scientific hypothesis of enhanced shielding put forward by scientists, including your own advisor, Mark Woolhouse. It seemed like every other week when you were Health Secretary and First Minister, an MSP would come to you with some wonder drug that would extend the life of people, like Perjeta for breast cancer, Translarna for muscular dystrophy, Vertex for cystic fibrosis, and you would always say that's too expensive and normally complain that Big Pharma was inflating the prices of the drugs. And yet, for lockdown, young people are paying with their livelihoods and the biggest national debt since the war. So why is it ethical to refuse all these drugs throughout your career, but unethical to, you know, make the older population shield and let the younger population mix freely and go on holiday and things like that?
Well, firstly, that is a completely inaccurate characterisation of how we of the drugs approval process. I never, as Health Secretary, have taken the decisions in that way. We have an organisation called the Scottish Medicines Consortium, which is independent of ministers, which does the health and economic analysis of drugs, and there's a whole range of different processes to come to difficult decisions. Often that involves lots of discussions with pharmaceutical companies about how we get the best price with the best value from drugs. So the way you've characterised the decision-making process there is just flatly wrong. But also, I just think the comparisons you're making there are strained, to say the least. Let me give you 3 examples of why I believe that this suggested approach, which I believe is a minority, and I believe even some who it is attributed to, it's probably taking out of context what their view is. But the approach goes, and I'm simplifying here, is that you just basically seal off the older, vulnerable bit of the population, make them, you know, live in a completely unnatural way with no contact with anybody else for who knows how long, and the rest of us just get on with our lives. Now, there's a number of problems with that. Firstly, how do we know who to put in that category? Older people, yeah, but who else? Is it people who are overweight? Is it people who've got diabetes? Is it people who've got heart disease? What are the criteria for you to be put in the category over there where you just basically are expected to have no life anymore? is the first problem. The second problem, that's not how we live. And how do you achieve that practically? Many of us as younger, relatively younger people live with older people. How do you achieve that practically? And then there is the ethical thing. Is that really what we're saying to a significant section of the population, that you just have to shoulder all the burden of this virus yourselves? And then there's the other point. We'd be actually misleading the younger, healthier part of the population into believing that they were not at risk of this virus. Young people are less likely to die, but there's not zero risk of them dying. And many young people, and we're hearing these stories all the time right now, are developing what has been called long COVID, where for a long period of time, after having it, they have chronic fatigue, they have heart problems, they have kidney problems, gastro problems. I just don't think that stands up to a moment's scrutiny, practically or ethically. We are dealing with an infectious virus here, and we are, I'm afraid, all in it together, and we all have to shoulder a bit of the sacrifice of dealing with it. And what I was saying yesterday is it will end. This is not going to last forever. Hopefully science will end it for us or bring it to a much more definitive conclusion soon with a vaccine. But until then, we're all going to have to pay a little bit of that sacrifice to get ourselves collectively through it. And I think that is it's not an easy approach, but it's better than just deciding one section of your population, has no life at all, in order for the rest of us to live normally, even if that was practically doable, which I don't think it is. Do you want to add any more to that?
Well, it simply doesn't work. I'd add a fourth argument to your three. It doesn't work because even with a vaccine, the virus is still going to exist. We will just live with it in an endemic way rather than a pandemic way. So if you release the section of the population, which would have to be a big section, they're going to catch the virus later. So all you've done is delay it. Even with a vaccine, we will live with COVID on an ongoing basis. Now, we will have better treatment, we'll have vaccines to protect people, but we live with flu in an endemic way, but it still causes illness and death. COVID, unless the virus changes in some way that is completely unpredictable, that's where we're headed for COVID, even with a vaccine. So you just let the people back out again, they'd catch it again.
Christine Lavelle from The Sun.
Thanks, First Minister. You told Piers Morgan today that a big preoccupation of yours ahead of winter is how we protect people in care homes better than perhaps was done before. Can you tell us what the significant differences will be? And similarly for hospitals, what will the key differences be to March? And just to clarify, are you saying today that you can't give us the evidence for transmission in homes versus transmission in hospitality premises?
No, I think I have given you the evidence, and a lot of it is actually common sense as well as science. What I'm saying is trying to put definitive numbers, because you don't have discrete categories and you don't always know whether somebody got it in a pub or got it in a house, but you do know that if these are the top places people are saying they've been, then it stands to reason that that is where they've got it. And, worldwide, you see governments introducing restrictions to try to deal with these areas of transmission. So I think I have given you the evidence. I'm saying we're trying to think about how we, in a reasonable and robust way, give more quantification of that. On the answer to your first question, I suspect you know much of the answer to this because you've very diligently been at a lot of these briefings, and a lot of these changes have happened already. We have a completely different approach to testing in care homes now. We have taken steps to make sure the guidance around infection prevention and control and isolation, that care homes are doing that. Obviously, we've worked hard with the sector around PPE, and similarly in hospitals. So there are groups of both staff and patients that are routinely tested now in hospital. We have much more data, which is published regularly, on nosocomial transmission in hospitals. So there's a whole range of ways in which practice and policy has already changed. But of course, as we go into winter, we are assessing and reassessing all of that. And I've asked for advice on other additional steps we should be taking just now, just to make sure that everything possible that can be done is being done. No. Derek Healy from the Courier.
Thank you, First Minister. We have learned that following your comments yesterday on working from home, elected members on Aberdeen City Council were sent a confidential note advising the meetings will continue to be held in person, something I know has caused quite a lot of concern for a number of councillors. Given other local authorities have been using video conferencing successfully, how appropriate is it for councils to be insisting councillors attend these meetings in person right now? And what kind of message do you think it sends to other employers?
I'm not going to comment on the note because I've not seen it and I don't know what the arrangements Aberdeen City Council are putting in place. What I would say is with all employers, they have to decide what is essential for people to be at work and other than that to allow people to work from home. But, you know, for the Scottish Parliament is sitting in person on occasion more regularly now than it was earlier in the pandemic, but not everybody can be there at once. There's physical distancing and some people are joining remotely. So, you know, where there are, you know, a democratic parliament, there is a good reason for accountability and scrutiny. It needs to be sitting. The same is undoubtedly true of councils, but within that, we need to make it as possible for people to work from home as possible. There won't necessarily in every situation, particularly the ones that you talk about, be an absolutely definitive line there. But I would encourage all councils to take very seriously the advice about people working from home, because it is an important way of trying to reduce the transmission risks that we face. Rachel Watson from the Mail.
Thank you, First Minister. I just wondered if I could ask about enforcement. You earlier said that you were asking people to please follow the new restrictions, but how will they be enforced? Looking specifically at households, for example, will there be extra money and resource for the police for this? And given over the last couple of weeks we've heard of growing frustration in the public about the restrictions, do you trust and are you confident that people will stick to these restrictions if there is a low chance of them being caught breaking them, for example, in households?
So in terms of enforcement, the police have been enforcing these kind of regulations throughout the pandemic. Remember, we had a stay-at-home rule in place at the earlier part, so I think the police in Scotland, with their very proportionate approach, have done a good job and they will continue to do that. The regulations that will give effect to the latest restrictions will be published later this week and people can see the detail of that. I believe you need to have enforcement where you've got things in law, because where there are people that are just flagrantly and egregiously breaching the rules, the police have to have that ability to enforce. But I believe the vast majority of people not just want to do the right thing, have been doing the right thing. And I believe that, you know, we're going to get higher compliance if me and my colleagues, if we explain to people why we're asking them to do things and the benefit to them, their health, the health of their families, than we are just by saying if you don't do them, you'll get fined. And so, yeah, there's always got to be a combination, but I choose to put more of my efforts into the persuasion, because actually I think in the situation we're in right now, the vast majority of people want to and will do the right thing. I also think we have to be careful when we're thinking about enforcement of not inadvertently putting in place perverse incentives. And I think particularly around self-isolation, we keep enforcement under review, but I'd rather support people to self-isolate, because the danger is if you say to people, if you test positive and you're told to self-isolate and you don't do it and you're going to get a massive fine, then the danger is what people will start doing is just saying, well, I'm not going to get tested because I don't want to know if I'm positive, because then if I don't know I'm positive, I'm not going to get told to self-isolate, or I won't bother downloading the app because then I'll never be contacted. So you just got to be careful you don't actually have a counterproductive effect there, which is why these decisions about the balance of persuasion and enforcement are really important here. And, you know, amongst the range of advice we take, we listen very carefully to very good behavioural science advice as well. What makes people more likely to comply? And I do believe that just persuading people that we're all trying to do the right things for the right reasons here. And I think we get further with that than we do with an overtly punitive approach. Tom Gordon from the Herald.
Thank you, First Minister. Can I just take you back to your letter to Boris Johnson? Kate Forbes wrote to the Treasury in June with a list of financial demands or requests, £500 million of extra borrowing this year, same amount of money of capital underspend converted to revenue and extended borrowing periods. Is your letter essentially an iteration of that request, or is it a substantial advance because of the change in the progress of the disease? And secondly, John Swinney was on the radio this morning talking about clarity of message and the importance of that. Now, today we heard Professor Leitch saying that if students are to socialise, his preference would be for them to go to licensed premises. And we also heard you say your preference would be to close those same licensed premises. I think a lot of people will just be wondering, should I go to the pub, yes or no? What is it?
I actually think most reasonable people, as opposed to people who understandably want to, and legitimately I hasten to add, want to scrutinise the fine detail of everything we say, will actually probably get what we're saying. Please just be really careful about what you're doing in a social context right now. So what Jason was saying is, if you're a student and you absolutely, are determined to socialise, do it in the regulated environment where all the rules are there, not in the place where we know that because it's not regulated, there is a much higher risk. That doesn't mean I am saying to students, pile into pubs. I'd rather everybody right now, just reduce their social interaction as much as possible. And we're trying to be as clear as that, recognising that I can give advice, we can make rules and regulations, but there is a part of this that comes down to everybody's individual decision and judgment. And I am trying to give people the sense of what I would do in these situations and what I hope other people do. But I think that is reasonably clear for most people. But if it's not, we always kind of talk and think about other aspects of our messaging that we can get clearer. Have we inadvertently confused that message? That's an ongoing thing and something we take really seriously. So obviously we continue to reflect on that. On the point about the letter, so I guess the sort of solutions that we think might have a part to play here will be in the same space as Kate's letter that you referred to. But I suppose the point I'm making to Boris Johnson is a more fundamental one. We are in a period of rising prevalence of the virus again. He called it a perilous situation yesterday. I think he was right to do so. I've described it as a tipping point. I think we both understand that we're in a really critical moment. And therefore, it's a moment where we all have to act early, urgently and decisively. We've done certain things. He hasn't. That's perfectly legitimate. But I think we will all be finding ourselves right now wondering, are we doing enough? And if we think we have to do more, we have to make sure we are equipped to do that. And I come back to this point that is a worry for me right now, is that for me to do more to try to get this virus under control than we've already done takes me into the realms of economic impact that I don't single-handedly have the ability to mitigate. And that's where I need to have the UK government playing its part here, either in doing these things itself or recognising I or FM Wales or FM Northern Ireland, if they choose to do different things, need to have that ability. So what the solutions to that might be are perhaps in the same realm as Kate's letter, but I'm just trying to get an understanding of the issue that we're grappling with right now and the importance of finding a way to get the right way through it. Libby Brooks from The Guardian.
Thanks, First Minister. This is just a quick follow-up on compliance. The Guardian reported overnight that local restrictions on household visits in the north of England have not been proving effective, partly because folk are just not complying. And I wanted to know whether you feel a nationwide ban, as we have up here now, is going to have a greater impact on compliance, and given that, whether you would have preferred to have seen a four nations consensus on it.
I suppose the point I've made all along is that I guess it is helpful rather than unhelpful if all across the four nations of the UK we're all saying the same things. But, the point of devolution is that we have the ability to do the things we think are right. And that is right and legitimate. And in these circumstances, I understand that people will arrive at different conclusions. These are not easy decisions for any of us. And that's why I've tried not to be critical of other leaders' decisions if they happen to be different to mine. But yes, obviously, the more we're all saying the same things, and broadly speaking, although the detail's different, we are saying roughly the same things. The more we're saying the same things, the better. But I think the other thing that is really clear is that we all, if the rules in Scotland, England, Wales and Northern Ireland are different, we're all very clear about that. People, I keep making this, which sounds like a a kind of daft point to make, but people know which part of the UK they're in. So the most important thing we can all say is if you live in Scotland, look to the Scottish Government advice. If you live in England, look to the UK Government advice, and Wales and Northern Ireland accordingly. The thing that worried me most at an earlier stage about the four nations mixed messaging was when the UK Government didn't make it clear enough that their decisions only applied to England, and that the Scottish Government or Welsh or Northern Ireland. I think as long as we get that bit right, then the fact that we might be giving slightly different advice on different things matters less. But the fundamentals that we're all trying to communicate are the same. Cut down your social interactions, abide by all the hygiene advice, do all the things we know that interrupts the chains of transmission. That's the most important thing. Libby's last question, so I'm going to give Jason any final opportunity either to say something about Libby's question or any final points you want to make, since I've talked a lot for the last few questions.
I think perhaps I'd go back to Tom's question. At least he asked for perceived difference while we were both still here. That was refreshing. There's no difference between what the First Minister and I were saying. Risk is relative. What I'm suggesting to students, to go back to where we began today, is there is risk. And if you choose to have parties, you're putting yourselves and your loved ones at more risk. There are rules that allow you to socialise safely, 6 and 2 households only, distanced in hospitality, so that might be better than the house party. Honestly, I'd rather you stayed indoors with the door shut by yourselves. That's unreasonable and is not going to happen. So risk is relative. You should make those choices for yourself, but bear in mind you're making them to keep you, your loved ones, your friends and your families safe.
Thanks, Jason. Thanks to all the journalists for joining us today. Thanks to Jason and Yvonne, who's been doing our BSL interpretation today. And thank you to all of you. We've gone on a fair length of time today, and I know some of my answers have been a bit on the lengthy side, but I think it's really important, particularly at this juncture, that I try to explain why we're doing different things or asking you to do different things, because I've said this before, when we go back to the earlier part, when I was just saying stay at home, that was simple for people to understand. It wasn't easy for them to follow. The messages are more nuanced now. They are more complicated. And sometimes I know people look at things and say, that doesn't make sense. Why can I do this but not this? And I'm trying to explain why things that appear to be inconsistent are actually just the essential trade-offs that we need to make. We have a global pandemic of an infectious virus. There's no vaccine yet. 100% normality, it ain't possible for us or anybody else right now. New Zealand, which probably has more domestic normality than many other countries, you can't leave or enter New Zealand. So that's the trade-off they're making. We're in a different geographic position. And therefore, some of the trade-offs we have to make are by necessity different, but we still have to make them. And we know our priorities: saving lives, protecting health, keeping schools open, trying to get non-COVID treatment in the NHS back to more normality, protecting jobs, protecting livelihoods. And if we're going to achieve all of that, we have to make the trade-offs elsewhere. And we all have to contribute to that sacrifice, which is why the tough restrictions we announced yesterday are so absolutely essential. But making these rules doesn't deliver the impact. It's everybody abiding by these rules that deliver the impact. So I appeal to all of you watching and to everybody you know that you spread the message to, please do that. We are at a very, very critical moment right now. And what we do in the weeks to come will determine whether we pull COVID back under control or whether it runs away from us again. And if it is the latter, many more people will die and become ill than would otherwise be the case. So this really matters now, just as much as it did back in March. So my thanks to everybody. I don't underestimate the sacrifice I am asking you to make, particularly after 6 months of this. But I'm not doing it lightly, and I'm not doing it for no reason. So please keep abiding by these restrictions. Please encourage everybody you know to do likewise. And to repeat what I said yesterday, it won't last forever. It will, it doesn't seem like it just now. It seems as if we'll be in this for the rest of our lives. But there'll come a point in the not too distant future where we are all looking back on this. But that point may come quicker if we all do the right things now. So my thanks to everybody for everything you are doing. This is Wednesday. Tomorrow I'll be joining you from the Scottish Parliament for First Minister's questions. I think that starts at 12:20, and I'll give the usual update before taking questions from the opposition parties. And we'll be back here on Friday at 12:15. But thanks for joining us today.